The fastest way to make your life more miserable at Special Forces selection is having shin splints. And in today's video, we're going to talk about how to avoid them and what to do if you get them during your prep. The first thing I want to cover with shin splints is the difference between shin splints and stress fractures, because none of this is going to work if you have a stress fracture. So how do we identify it? Well, shin splints is referred to as MTSS, which is medial tibial stress syndrome, and that is pain along the edge of the shin bone, which oftentimes spreads out. It's going to feel like it's radiating in a particular area. And this is caused by repetitive stress to the tibia from the muscles and the connective tissue in the area, like the muscle, the tibialis. Next is stress fractures. And with stress fractures, you're going to feel a similar pain, but it's going to be a lot more pinpoint. And then often with stress fractures, it's not going to subside when you stop running. If you have shin splints, usually when you stop running, when you remove the impact and the thing that is causing that inflammation, it starts to subside. And then this one is a little bit more serious. If you start having stress fractures or it's a very pinpointed area in your leg, you need to have a medical evaluation and have imaging done so you know the root of the problem. And everything we cover today, if you are someone who is constantly battling shin splints, the best thing that you can do is to go see a physical therapist and do a lot of these diagnostic tests in person to get to the underlying cause of what is going on with you. Now, what are the causes as to why we get shin splints? Number one, and I'm gonna freaking underline this like 5 times, is too much too soon. 99% of the time when I talk to guys who have shin splints and we start dissecting their training plan, they went from running 5 miles a week to 25 miles a week. And I get it, because you commit to going to selection, you commit to a big goal, to a marathon, and you want to be at that mileage per week overnight. But we have to have a gradual progression up to that point. So a rapid increase in mileage is the biggest contributing factor to getting shin splints. And this is caused by poor impact resistance. Even if you're a fit guy, you have muscles, you've been training, you've been doing other different forms of activity for a period of time, connective tissue takes longer to develop than our big movers themselves. So we have to have that gradual progression. Number 2 is weakness or imbalance. Underdeveloped calves, tibialis, hip stability, can't handle the load. So what happens is compensations and starts putting a lot more stress on that muscle and creating a lot of the inflammation leading to the pain. Number 3 is footwear and surfaces. So if you have worn out shoes, or if you have lack of support, shoes that don't fit you right, or you're running on concrete all the time, if you're constantly just developing a lot of inflammation from that, it can be an issue. And then number 4 is poor recovery. This one happens a lot as well, because guys think that they need to run every day. I did the same thing. I wanted to run 7 days a week, because if you take a day off, you feel like you're not making progress, but you have to recover and allow your body to clear out that inflammation or the stress from the sessions. So how to properly prevent shin splints? Again, number 1 is going to be proper progression. We have to gradually increase the mileage or the weight with ruck marching. This means typically there's a rule of thumb saying no more than 10% per week over week for adding mileage. We can go a little bit above that, but it really depends on the individual and their training history. A good rule of thumb is that 10 to 15% mark week over week for mileage. And then take recovery days. Don't go from 0 running to running 7 days a week. Even for many of our advanced athletes that are training for selection, that are balancing strength and conditioning, we have them running 4 times a week with a couple strength days and some cross training mixed in there as well. So running, you don't have to run every single day to make progress with your run times. You can run 4 times a week and make tremendous progress. If you haven't seen the latest running video we did, we talked about the 4-run formula for that. Number 2 is footwear. The best thing to do with your footwear is to go get fitted. There's not a universal best shoe for everyone, but there is a likely best shoe for you. So go to a local run store where they're going to have somebody that can analyze your gait, analyze your form. They have machines you can step on and pair you up with a shoe that is going to fit your gait and how you are impacting the ground. Next is replace them every 300 to 500 miles. I know it's a pain in the ass because shoes are expensive, but replacing those is going to save you a lot of headache. And then vary terrain and use a track and a trail. Especially if you are starting to notice your shins getting tight, things like that, stop running on concrete for a little bit. Find a local track, find a hard compact trail, something that's not super jagged and you're gonna roll a freaking ankle on it, but find somewhere that's a little bit softer surface, and that's going to reduce the impact, that vibration that creates a lot of that inflammation in the tib. And then number 3 is strength and durability work. And this is one of the things that we talk about with, should I just do body weight or should I strength train? One of the best things we can do to drive up our durability is strength training. So hitting your calves with straight and bent knee raises, hitting your tibialis with body weight raises, tib bar or banded tib raises, and then hitting your hips and core. Hips and core are huge, not only for shin splints, but IT band syndrome. Many issues that guys will experience actually stem from the hips. Even a lot of knee pain actually stems from the hips. So things like side planks, airplanes, clamshells, step ups, step downs, obviously your big lifts as well, but hitting that glute medius is going to be huge to maintain that stability and make sure that we have the proper stability so we're not compensating while we're running. And then number 4 is mechanics. One of the biggest ones with mechanics with guys is overstriding. I see a lot of overstriding, and when we're overstriding or putting our foot in front of us, landing on our heel, getting a big fat heel strike, we're putting a lot of impact on that tibialis, and we're stopping our momentum with every run. So bring it back a little bit, have that foot strike underneath your center of balance or your center of mass, shorten up those strides and aim for a steps per minute of about 170 to 190 beats per minute. A good way to do this is throw on a Spotify 180 beats per minute podcast and start matching your strides with it on a zone 2 run and working it a little bit. And then recovery and nutrition. Gotta sleep, guys. Gotta freaking sleep. I don't know how many times I talk to guys that are like proud that they're able to function on 5 hours of sleep, like Parker behind the camera here, who stayed up till 3 a.m. last night. But there's a lot of times that we feel like, we're making so much progress when we're not sleeping. Sleep is absolutely crucial, both for cognitive function and absolutely to give our body the ability to recover, to release the most amount of human growth hormone and clear out a lot of that inflammation that is going to cause issues if we don't get the time to rest. Now, what do you do if they show up? If you have shin splints, one of the worst things that you can do is just trying to push through it and running through shin splints, thinking that they're eventually going to get better. What's going to happen is you're going to battle them your entire prep, and you're not going to see the results that you could, and you're probably going to take those into selection and undermine your entire performance in that environment. So the biggest thing that we need to do right off the bat is reduce the volume. That doesn't mean we stop training, but it does mean we switch to other low impact forms of cardio, like the bike, like the rower, like an incline treadmill walk, or other forms of cardio that is not going to flare up that tibialis. We still make progress with cardio, but we reduce the volume of the high impact work and the high impact strength. So we're not doing things like, trap bar jumps, box jumps, dumbbell jumps, etc. And then number 2 is target strength and mobility. And this is all the things that I talked about with calves, tibs, hips, and core. I like to include a lot of the tib work, plantar fasciitis work, so plantar flexion and core stability work inside of warm-ups. You can get a quick warm-up inside of that activation portion of a ramp warm-up, which is going to build up that strength and enable you to do it on a very consistent basis. So make sure that you are hitting targeted strength work for that tibialis, for your abductors, adductors, and driving up that stability and putting us in a position to recover quick. And then 3 is soft tissue work. Foam roll the calf, foam roll the tibialis, not the actual bone itself, but the muscles. And when you foam roll, you shouldn't spend 45 minutes just beating up your muscle or sitting there with a percussion gun, destroying your muscle like you'll see in most CrossFit gyms. What you want to do is roll real quick, looking for those tight and tender areas, and then maintain pressure on it for about 30 seconds. Do that for about 3 to 5 minutes per leg, and then move on to the other problematic areas, calves, hips, whatever. We want to get a little bit of soft tissue work. We don't need to sit on the ground, freaking rolling around, beating up our muscles all day long, creating a bunch of stress. Number 4 is going to be footwear. So like I said, get fitted. Get fitted for insoles. Getting some custom insoles can be a little bit costly, but it can be a big, saver of headache and the pain down the road. So absolutely worth the purchase to get some custom insoles. And then for acute relief, we can do compression and elevate. You can ice and things like that, but studies have shown that icing and taking NSAIDs or taking ibuprofen, anti-inflammatories, actually reduces the recovery process because those inflammatories or the inflammation is necessary for our body to actually recover from it, not just reduce the pain in the short term. So if you're in an environment where you have to perform back to back to back, yeah, you can absolutely do those things. If we're in an environment where we just want to clear this out, get stronger and better from it, then typically we just want to stick with compression, elevation, and rest. Returning to running. Number freaking 1 is going to keep it subtolerant. We want to keep the runs subtolerant, meaning we're not running to the point that we feel the tibs firing up on a run. So for example, if I notice that I go out for a zone 2 run, I feel good the first mile and a half, but at that 20-minute mark, my tibs start to flare up. Well, I'm going to reduce it to like 15 minutes, 14-minute zone 2 run. And I'm going to cut it off before I start to feel that pain come on. And then I'm just going to gradually build that up. Maybe on the next one, next week, I'll try 18 minutes. Maybe I'll try 20 minutes, working that up week over week. If it's really bad and you can't even go like a quarter mile without running, you can start with 3 sets of 2 minutes of light running, 3 minutes of walking, and just getting stimulus like that and building it up over a period of time, keeping it sub-tolerance. So start short and be patient. This is huge because when we're talking about driving down your run times, when we're talking about driving up your impact resistance, your miles per week, the fastest way to make progress if you're experiencing something like this is to take a step back and have a gradual progression into that. It's not to continue to try to work through it thinking and hoping it's going to get better. So understand that when you're being patient, it's actually the fastest way to increase that overall performance level to those advanced levels where we want to be. And then increase the mileage only if pain stays low. Like I said, if pain is good, we don't have any pain, or it was very minimal on a run, that's the only time we want to increase the time for the next one. Don't just stick to a progression and try to force it to work if you're getting that pain and it's not subtolerance. And then threshold and intervals will be last. So we primarily want to focus on those zone 2 runs. We primarily want to focus on those easy efforts. And then as we're continuing to get more confident with it, we're seeing less and less tib flare-ups or issues with those tibs, then we can start the threshold work. Again, starting a little bit lower intensity, a little bit less overall volume, and building that up as well. So that is how we can avoid shin splints in the first place. It's just gonna be the best way to tackle this entire issue and then handle them if we get them. Stay patient with it. And if you need a structured approach to get back into running and get back into those miles per week that you need for selection, there's a link down in the description to see if working with myself is a good fit. Other than that, appreciate you watching. I'll see you in the next one.